So this is my current situation. Excuse my voice. I had carpal tunnel release surgery on my left arm. And this is what I'm left with. This big padded bandage type thingy. And sleeping with my arm up. I guess it's supposed to be up higher. Like you're raising your hand and you're supposed to be, oh, that hurt, squeezing your fingers. Who sleeps like this? Let me know, please. Oh. Hey y'all, it's your girl, Tanya J. This morning, this is Monday, March 11th. I had to have carpal tunnel release surgery. My surgery was supposed to start, I was supposed to arrive at the hospital at 6:15. That means I had to get up, leave my house at by 5:30 to get there maybe at 6, and then check in. It takes about 30 minutes to get to the area. Check in, which I did a lot of it online through the app to make it easier, and just wait. So they started off, I already had paid my copay. They gave me my medical band, and this one right here is because I have allergies. I'm allergic to moxicillin. And then the lady went, once I finally got to the back, because you couldn't eat anything, drink anything if you had medications that you had to take. They tell you what particular ones you can take with a small sip of water. So, and this right here is some pillows to prop my arm up. And I can use the tip of my finger to hold the phone. You are being propped up on another pillow in the bed, scarf on, pajamas. So the lady tried to do my IV in my arm. She pricked me. Yeah, I don't like needles anyway. Pricked me. My vein rolled. Pricked me again. I was like, do you have to do it in my arm and my wrist and in the back of my hand? Can't you use like at my near my ankle? No, shit. Oh, y'all, I'm sorry. Can't you do it near my elbow? You know, where the veins are, where you usually draw for blood. She's like, well, they prefer that you do it in the hand, but you can't do it in my hand. You haven't done it in the hand. She said, you're probably going to have a bruise there. I'm sorry. And I was like, okay. So then they also have the blood pressure cuff on you. I guess to be checking your blood pressure while you're under anesthesia and everything like that. So she had to move the blood pressure cuff up so that she could do the IV now near my ankle. Why do I keep saying ankle? I'm probably still under some anesthesia. Near my elbow. So I have another one of those bandages that stretches and tightens up there. But this is what's going on with my wrist. So surgery was completed. The doctor came and marked on my hand. You know, they make you verify your name, your date of birth, and everything like that. And I'm not sure when the surgery started, but they give the person, you have to have someone that comes with you. They gave the person that came with, which was my husband, they gave him a card and a number. And then the card has, I guess, your patient number, and there's different color-coded items to tell whether you're pre-surgery, you're in the back, you're going, what location you're in, and what part of the procedure you're at. My wrist is starting to hurt from trying to hold the tip of the phone. And you're they give you 2 vials. One is to help with nausea after anesthesia, and then I'm not sure what the other one's for, because you're not really coherent because of the anesthesia, so your time goes slower than it actually is because you're out of it. So anyway, I remember waking up, which I must have woken up a little bit earlier because I was drinking a Sprite. The nurse afterwards. Okay, let me go back a little bit. The first set of nurses are the ones that kind of prep you. Then there's the anesthesia team and the surgery team, and they all come out and ask you all these different questions. They look in your mouth to make sure you don't have any items that are loose. Dentures. It's a long, lengthy questionnaire of things that they go through that you answer prior, during. But they want to look in your mouth, I guess, in case they have to stick a tube down your mouth. They don't want to knock out any of your teeth, or if you have false teeth, or if you have any items in your mouth that could be dislodged, to help if you need assistance with breathing during the procedure. They want to check for those items. Also, you wear no jewelry. However, I have a date piercing in my ear. I can't get that out. I'm not trying to get it out. So what the lady said during anesthesia, she's like, I will just put tape on it so you won't get burnt. I said, burnt how? What would I be getting burnt with? And it's like she realized that she said it, but then she's like, oh, don't worry about it. We'll just put tape on top of it. We do that all the time. I was like, what you gonna be burning? Why? I don't know what, unless it's, I have no clue. And she didn't want to expand on it. So anyway, I went through that team and them asking me questions. And then at the end, I remember waking up and the guy being awoke, because I don't think I was fully aware, and I was drinking a Sprite and he was giving it to me with a straw. Then there's another female that came, another nurse, and she came to help me get dressed, to put back my clothing on, to help me put your bra on, underwear, everything. And I remember kind of getting in a wheelchair and being rolled out to the car. And then I remember getting breakfast, I think, at Burger King. But I don't even know where I was at what Burger King. I remember saying what I wanted to eat. And then I've had that Burger King item, which was a croissant and some orange juice. And it's now, so that had to be before 10:30. It's now, let me see. Oh, I don't have a watch up. So it's now, let's see, 4:53. And I finished the croissant. I must have ate. But I do remember at certain times having the food in my mouth and kind of passing out and remember, oh, chew, girl, for you choke. Chew and swallow that stuff before you choke. So you see, I went with a dress on because I figured it would be easier to remove in case I got home and then I couldn't unzip pants, pull them down. I didn't want to do too much with the hand, even though it's not my dominant hand. It is my left hand, but still you require left and right hand to do a lot that you're not aware of. So you're going to need some assistance. And there's certain things that you kind of want to do for yourself. Even though my hand is still a little numb, I think it's kind of wearing off. So, see, I have to lay in the bed. Hand up. I got these pillows propped to keep my hand up. And he says to squeeze your fingers still. So that's all I've been doing when I'm not asleep. Today is day 1. We'll see what happens. Oh, and I'm taking, they suggested, my throat is dry, that you take Tylenol and Motrin according to the bottle. And not at the same time, but at opposite times as scheduled or as directed on the bottles. Just remember, you're going to need some pain pills. And because I'm allergic to, I don't even know if they did a prescription. The person that goes with you will receive all of your checkout information. Make sure it's someone that you can rely on so you know if you have to take whatever. And that they're able to communicate that with you. I'm getting a spam call. Make sure that they communicate that with you. Or stay on top of your meds. Get all that stuff done for you. But yeah. This is me. And they told me because this is my non-dominant hand. Today's a Monday. Oh my gosh. Who are all these people that be calling you on spam? And what they want? I don't want nothing. So, I'll be out for a week and a day. The week is to recover and the additional day. So on the 8th day, I'll say, on the 8th day is when I get my stitches out in my hand. And I guess they'll determine if things are going okay or whatever. I don't know. But this is different from when I had it before. All this padding on this arm. It goes all the way down. You are not supposed to wash or bathe. I was thinking, oh, I can take a bath. I'm not getting it wet because if I get in the, well, I don't know. If I get in the bathtub, I'm going to need to be able to get out the bathtub. I can put a plastic bag on it. Who wants to go without washing? I know some of your kids do. I don't. So, you might find a way around that, which I call like a, we grown. You're going to be like doing a Hoe Bath, okay? You going to need to. 'Cause don't nobody want to be smelling you, okay?
I could have stayed in there for hours. I'm taking a whore bath. I'll be out in 30 seconds.
I don't care if you had your arm cut off. A sponge bath, something. You need to get all in them crevices, okay? Do what you know is right for everybody and all parties involved. Yes. Get her done. Okay. Y'all, I think I need some pills. So I'm getting ready to go back to sleep. I'll let you know if anything or when things start to change. Y'all, why they do this to me? Look at this. Why I let them do this to me? Help me.